According to DIE 2018, the goal of treatment for women with uterine fibroids is symptom management, prevention of further growth, and fertility restoration. Hospitalization is indicated in women who are experiencing severe enough bleeding that they need a blood transfusion, or women who are having a surgical procedure performed. It is recommended that women with uterine fibroids be recommended to specialists to ensure proper treatment. These specialists would be obstetrician, gynecologist, or radiologist. Treatment is a little bit difficult for uterine fibroids as the medications are only able to be administered for a limited time, and the surgical procedures all have a risk of impairing childbearing. So the treatment is based on the woman's desire to have children, the size, the number, and the location of fibroids, the age of the woman, symptoms, and symptoms present, according to DIE 2018. Treatment is indicated if women are having severe bleeding or requiring blood transfusion, the size of the fibroid is interfering with the urinary system, or the woman determines that these symptoms are no longer acceptable. For treatment of heavy bleeding, a woman can be given non-steroidal anti-inflammatory drugs, NSAIDs, tranexamic acid, or hormonal contraceptives. These options, they will not change the size of the fibroids much, but they will help decrease the bleeding. Options for contraceptives include progestin only or estrogen and progesterone combination, and they're available in many forms. This is according to DIE 2018. Surgical procedures. So for surgical procedures, the mainstay for a long time has been hysterectomy. This is the only permanently curative treatment. It is shown to have 72 to 90% decrease, at least moderately, in the symptoms, and it does have some risks. So it is expensive, and you can have post-operative hemorrhage, fever, damage to the tissue around the uterus, and you could have urinary incontinence or vaginal prolapse following the procedure. There is also a risk with any procedure that has morcellation as a part of it. So this is used to take out the uterus in smaller pieces so that the size of the incision can be smaller. But there is the chance of leiomyosarcoma that is unidentified or unsuspected being spread to other parts of the body and leading to cancer. This is according to DIE 2018. Myomectomy is a good procedure for women who are wishing to preserve fertility, as it means you get to keep your uterus, but there is still a risk associated as pelvic adhesions may occur, and they also can inhibit fertility. And this is, I don't remember if I said this, is according to Al-Hindi and Salama 2006. This kind of procedure can be laparoscopic or open, and there is also the fact that 20% of the patients who are treated with this method have to have a second procedure at some point. And morcellation is also used sometimes, so that is, again, we need to educate patients on the associated risk with that. And this is according to DIE 2018. According to Al-Hindi and Salama 2006, another option is embolization. So this method attempts to cut off the blood supply to the fibroids. A radiologist performs this procedure, and often patients will need to be hospitalized afterwards because of the severe pain and the need for analgesic treatment. There is a possibility of not being able to have children after. They can miss some of the fibroids in this treatment, and there is a possibility of malignancy, but it is a less invasive procedure. According to DIE 2018, this is a good treatment for women who do not want to become pregnant, have multiple large fibroids, or they are not good candidates for surgery for other health reasons. The success rate, 82 to 90% for decrease in menorrhagia and 77 to 86% for dysmenorrhea, plus the symptoms will be decreased related to size, and 10% of the people or the women who need this intervention will need another intervention within several years. Ablation is another option. So this is ablation with magnetic resonance guided focused ultrasound. So this is high intensity ultrasound, and they induce coagulation necrosis to the fibroids. So this is recommended for women who have a single or a few moderately sized fibroids, and they have a success rate or improvement of 80% over 6 to 12 months. But the long-term efficacy is unknown. So those above treatments, according to DIE 2018, are recommended for women who desire to maintain their childbearing abilities, but there are risks involved, as also I mentioned. So some other less common procedures, I'm just going to mention them, are laparoscopic or vaginal ligation of uterine arteries and laparoscopic cryomyolysis or thermocoagulation, according to DIE 2018.